Hello again, Dr. Eric Ruhland from the St. Paul Pet Hospital. Say, I've been receiving a lot of questions about vaccine protocols and why is it we have to vaccinate dogs so frequently for so many different diseases. It's extremely important for overall health of your pup, and I'm going to go through some vaccines that we commonly administer at the clinic. Going from them in order of sort of importance and legality: rabies, distemper, Lyme's disease, leptospirosis, and bordetella. So starting at puppies, dogs will commonly receive what's called the distemper series, or the distemper shots. Now, distemper shots is actually a combination of 4 different viruses: distemper, adenovirus, parvo, and parainfluenza. There's 4 different viruses in that shot that they're getting as a puppy. Now, they'll get that shot 3 times because a puppy's response to that vaccine is not very good, and we want to try to get those antibodies up nice and high before they're starting to get exposed to a lot of dogs, before they're going out to their puppy classes, and before they're going out to the dog parks. We want to make sure that they have those antibodies high. And it's every year for the rest of their life. They'll get a distemper shot. So distemper is core in our practice, as well as rabies. Now, rabies is core across the country. There's actually areas of the country where it's illegal to not vaccinate your dog for rabies. Rabies obviously is a virus that is carried by wild animals, and in our area here, a lot of skunks and a lot of bats in Minnesota carry rabies. It is a very important disease because it is life-threatening and there is no cure for it. The prophylactic shots that people receive after being exposed to a potentially rabid animal are extremely painful and extremely expensive. That's why it's so important that we always keep our dogs up to date on rabies. Leptospirosis is a fatal disease in dogs, and it is zoonotic as well. It's like rabies, that it can go across species lines and can expose people as well as dogs. Leptospirosis is a bacteria that lives inside the kidneys of mammals, and it's shed in the urine. And by the time we see clinical signs in the clinic, it's generally too late to treat that dog, or if we do, it's a very grave prognosis. It's a very cheap vaccine, and it is very effective, which is why we almost always recommend leptospirosis for all of our dogs in the city, as well as our dogs that are going out into the country. Lyme's disease is obviously carried by ticks, by deer ticks in Minnesota. We have a ton of Lyme's disease here in Minnesota. Very important to vaccinate our dogs every year for Lyme's disease. It can cause a lot of joint disease, a lot of problems. Bordetella is a bacterial agent that lives in the nose of a lot of dogs. That's typically referred to as kennel cough. We give that vaccine every year as well to a lot of our dogs. But more specifically, a lot of dogs that are going to get boarded, that are going to kenneling facilities, that are going to get groomed. Well, thank you very much for listening. I hope this shed some light on vaccines and vaccine protocols. I know vaccines can sometimes be kind of polarizing for some people, but the truth of the matter is vaccines have helped eradicate disease and help limit disease and help our pets live longer, happier, healthier lives. Ever have questions, feel free to call the St. Paul Pet Hospital, or we can talk about it in the exam room when you guys come in to have your vaccines and your wellness exams. I hope that helps, and if I don't see you in an appointment soon, I hope to see you around the great city of St. Paul. Thanks a bunch.